As Randy had touched on before, in 1923, members of the Kosair Shrine Temple, doctors, lawyers, and other community leaders recognized the need, that there was an urgent need to provide medical care for crippled children in the Louisville area in the state. And that was a time of poverty and typhoid fever, polio, diphtheria, smallpox, and that killed a lot and disabled a lot of the children in our area. In 1926, Kosair Shrine Temple opened the hospital on this campus, and the name of the hospital was Kosair Crippled Children Hospital. And the hospital was owned by Kosair Charities, which is the charitable arm of Kosair Shrine Temple. In 1986, a decision was made to merge our 100 beds with the Children's Hospital, which is a part of Norton's Healthcare. And it provided a full range of medical needs for and care for children, and created a new entity, Kosair Children's Hospital. So I know it's confusing, but the original hospital here was Kosair Crippled Children Hospital, and when we merged our beds with Norton's, it became Kosair Children's Hospital. So that's the difference. And like I said, a lot of times people, it is confusing. Kosair Charity still remains the largest financial supporter of Kosair Children's Hospital, and as Randy said, we have committed $200 million to make sure the children are cared for. Since Kosair Charity is no longer responsible for operating a healthcare facility, Kosair was able to broaden its scope of support for children in our area. Today, the medical needs of children have changed, but our commitment has not, and our focus remains the same. Over the years, in an effort to expand our ability to help more children, Kosair Charities has formed many strategic partnerships with pediatric resource organizations in which we share a parallel mission. Since 1950s, Kosair Charities has awarded $335 million to serve thousands of children through pediatric organizations or on an individual basis. Our former mayor, Lieutenant Governor Jerry Abramson, stated that Kosair Charities is the driving force behind pediatric programs and services, and not only have they been a godsend to thousands of families, but they've helped spur medical and economic development in the community. Last year, we provided support and assistance for over 90 organizations in the Kentuckiana area, such as the Home of the Innocents, Down Syndrome, Visually Impaired Preschool, the Kids Center, Court-Appointed Special Advocates, CASA, Family and Children's Place, Shriners Hospital, and the University of Louisville. As was stated, the University of Louisville Medical Department is our original and longest partner in providing for medical needs for the children. And this is due in part, as we discussed with Dr. Barnett Owen, who was a Shriner and the state's first orthopedic surgeon. And he also taught at the medical school. The University of Louisville Pediatric Department and Kosair Charities have worked shoulder to shoulder for 90 years, protecting and taking care of the children in our area. Our partnership helps provide the needed research, treatment, and protection for the children. And at this time, I'd like to introduce Dr. James Ramsey, President of the University of Louisville.
Jerry and Randy, and to everyone associated with the Kosair Charities, congratulations on this wonderful 90th anniversary. 90 years of service to the young people of this community, 90 years of commitment to this community. And Randy, I think you really said it best, 90 years of love for the children of this community. Congratulations to the Kosair Charities. I'm here today to just say thank you. Thank you for allowing us to be your partner. Because of our partnership that we have with Kosair Charities, it allows us at the University of Louisville to achieve our statutory mandate. And by us achieving our statutory mandate, that allows you to help precious young people in our community. So we value deeply the partnership that we've had in so many areas. I won't go through them all, but the list of partnership areas that we're working with Kosair Charities continues to grow almost every day. And I'm reminded of a meeting we had in this room about a week before Christmas. Speaker of the House, Greg Stumbo, and his wife were here. We had many of our faculty from across the university here. Dr. Eli Capilouta from the University of Kentucky was here, and we were focused on what could we do together through the Kosair Charities and the great support that they've provided us for our creation of the University of Louisville Autism Center to deal with that growing problem. So I tell the story and was talking with Jerry and Pat about growing up in Louisville, remembering coming to this campus for the picnics when I was a kid. So I look forward to the picnic in September. But you would drive by the hospital on Eastern Parkway, and as Pat was saying, the end down there was the sunroom. And you would see people laying in you'd see young children laying in their beds as you went by. And you thought about the horrible disease of polio. And I remember as a child going to the elementary school on Sundays and getting my first, I think, Jerry, they were shots, and then they were little sugar cubes that we would get with the Salk and Sabin vaccines. But if you stop and think about that, and someone's already mentioned it, the incredible advances that we've made in healthcare, and we've been able to eradicate, as a rule, polio, but we've got so much more to do. And I'm going to echo what the mayor said, a great 90 years, but we look forward to being your partner for the next 90 years and continuing to make great advances in helping young people in our community. The person who is leading this partnership, the advancement of the partnership, and will take us in new directions with Kosair Charities is Dr. David Dunn's been with us about 18 months, so let me turn it over to David.
Well, thank you very much and good morning. I had the great privilege, and I say this sincerely, of being one of the group here for about 2 minutes when Jerry Ward loaned me his fez this morning. And I actually say, I don't say that tongue-in-cheek, because when I came here a little over 18 months ago and was driving around Belknap campus, Shelbyville, other places, getting to know Louisville, from a geographic standpoint, I saw these statues, and they're statues, as you know, with a child with a crutch being held by a gentleman with a very elegant fez. And I said to myself, you know, this must be an interesting group. And my first introduction was the charities giving away close to $20 million within about half an hour. And I was just totally amazed by that. And I've subsequently come to know Jerry, Randy, and others quite well. They're great friends of the university and the community. And let me just tell you some of the things that they haven't mentioned that are going on here. They're brand new pediatric and pediatric dentistry clinics that are being built. And this is just amazing, because these are going to be state-of-the-art facilities in this building that had iron lungs in it at one point. So to the comments that have been made, the way pediatric medicine, the entire gamut of pediatric medicine will be advanced is through research, training the next generation of healthcare practitioners in these areas, and the care of the kids. And Jerry, Brad, all the folks here from the Department of Pediatrics, you know, the nurses and other caregivers at Kosair Children's Hospital, they're the ones who do it. We can't advance the field, though, with ongoing state budget cuts, with the NIH budget completely flat or diminishing year to year, unless we have a group like the charities. And they're the ones that make the difference so that we can keep doing the clinical and translational research. They put all of their energy to that, working with the U of L. And so I want to join everyone else in sincerely thanking them for all of their efforts. And it's very clear, I think we're going to have more than 90 years. We're going to have a couple hundred more years working with them. So thank you all very much.